Good afternoon. It's a privilege to be here, and I want to thank you for inviting me to give this talk. For about the last 10 years, we've been looking at how the built environment impacts health. The ideas came from working in environmental health and seeing that many of the things in environmental health might, increase cancer, 1 case in a million from a small increase in a toxin. That's relatively small numbers on the impact on overall health, whereby how we build the world around us has major impacts on obesity, on climate change, on a whole range of health issues. And so we've been looking at how well can we document what that relationship is between the design of the built environment and public health. And in particular, how can we build links to the people who build the built environment? Public health does not build roads and sidewalks and transit buildings or anything else. Public health works on the health of people. The people who build the built environment around us are the architects and planners and developers and city councils and zoning commissions and others who make the decisions of what can and will be built. And so we've been looking at how do we build those links to those professions that make those decisions and have health be one of the considerations in those decisions. We have lots of choices on where we live, where we work, where we play. We have cities, suburbs, rural areas. Health itself is a broader concept. The World Health Organization uses the statement, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's where the built environment comes in under not just physical health, mental health, but really the livability of a community. What affects health? We know from the medical world that we can work on educating patients or giving them a treatment, giving them a drug, giving them a vaccine. And they're all relatively short-term, small numbers interventions, whereby if we change the built environment, we can change the context in which people make decisions about their behaviors and therefore have a much larger and longer-term impact on health. This is a summary of much of what I will be talking about, which are the areas in which community design affects health. The one that gets probably the most attention is physical activity and obesity. When people say, what are you working on in one sentence? If you want people to walk, you need to give them the physical place to walk. Land use affects obesity, physical activity, cardiovascular disease. It affects the water quantity and quality. It affects our access to healthy food. How we build our communities relates to automobile dependency. The more we use our cars, the issues of air pollution, asthma, climate change, car crashes, pedestrian injuries, as well as community design affects social processes, mental health, social capital, environmental justice issues. And I'll say a little more about each of these. Physical activity, as I say, is the one that's fairly obvious. That's what people understand. People need a place to walk or to be physically active. Why does it matter? We have very good studies showing links between physical activity and health. Relationship, a sedentary lifestyle increases risk of overall mortality, heart disease, certain types of cancer. Low physical fitness is comparable to some of the other major heart disease risk factors such as high blood pressure, cholesterol, diabetes, even smoking. What determines physical activity? Basically, people do it if it's convenient and attractive. They avoid it if it's difficult. So that if there are places to go, if there are sidewalks there, if there's other people to be with, it's more likely to happen. If you don't have much time because you're doing long commutes, you're tired, you're not motivated, you don't feel safe in an area, people then are less physically active. Obesity and physical activity are not the same thing, but they are highly related. So some of the outcomes of obesity include overall mortality, heart disease mortality, gallbladder disease, diabetes, hypertension. In looking at some of these issues, we've looked at some of the unintended consequences. So this was one that actually got a lot of press, was the idea that over about a 10-year period, Americans gained about 10 pounds. It costs an airline fuel for every pound that they fly. So we did a very simple calculation of how many miles were flown in the year 2000, a lot of miles, times what it costs in fuel to fly that extra weight. and you end up with many millions of gallons and climate change impacts from just an unintended consequence of obesity was that extra fuel used by airlines. Obesity in the US has been a major epidemic, as it has in much of the developed world. This is going from 1995, the blue colors are between 10 and 20% obese in the nation, to 2010, where nothing is as low as 20%, and all the colors are 20 to 30% or more. A little bit of data from Australia, very much similar trends. If you look at the obesity between 1995 and 2011, the numbers going up for those who are obese and down for the proportion who are a heavy weight. Design issues. We can design to make a place attractive and easy to walk. We can design it so it's very difficult. And this is a schematic that plays out, if you look many places on how things get built, between suburban development with a lot of disconnected places where you basically have to go out to a major road to get to any place, versus a more traditional neighborhood with a grid where things are much more accessible for walking and biking. You can see this actually flying into many major cities. Just look at suburban development. You could have two kids who live a couple hundred yards apart, where it could be a mile or more just for them to visit each other, because you can't cut through someone's backyard to get there. We also get strange policies. This is one that says we'll have a law that says we want a curb cut for the wheelchair. We have a law that says a property owner has to build a piece of sidewalk in front of their property, and then nothing that says the two need to be connected. Not that uncommon. We have lots of pictures like that. Another one, I don't know whether the sidewalk or the power pole came first. It really doesn't matter. Why does it exist? You wouldn't put a pole like that in the middle of the street and say, well, the cars will go around it. We build some great clover leaves that are very good for moving motor vehicles, but when it comes time to I want some green parkland, well, obviously that's pretty much unusable space. If I want a bicycle, that's utterly unusable. And it's a choice by the transportation world of how to use our land and what and who gets moved. On the other hand, we can do transportation design that encourages physical activity. This is a new bridge in Charleston, South Carolina. You can see the old bridge in the background before they tore it down. Big fight over whether there should be a walking and biking trail on the bridge. They did eventually build that walking and biking trail, and it has been so popular they're actually fighting over building parking at the ends of the bridge, because it's become a destination where people drive to the bridge just for the fun of walking and biking on it. And I've understood Auckland is having some of that same issue right now on whether to get walking and biking on their large bridge. Parks being a very central part of how to get people physically active, and even how they're designed. Some of my not so good examples are from Atlanta, where I was living when I was working at CDC, and Atlanta has done a number of things that are less than ideal. So a park where you can really only drive to it, compared to a park on the other side where people can walk to it. There is an issue, though, that we're not telling people how to behave. People will choose how they want to behave, and that's absolutely fine. I mean, we're not trying to have the nanny state where we're going to tell you got to go out and be physically active. We want to produce the environment that makes that behavior desirable and encourages it. In this case, it turns out that was a show dog who needed more physical activity than the woman in the car could give it, so that's how she chose to exercise it. Again, an Atlanta example, there's something called induced demand, not a real surprise. If you have a busy road and make it larger, surprise, you'll just get more people using it. This was one where in a city with very poor public transit, with about a 16 or 18 lane highway, why don't we make it 23 lanes? That'll take care of it, won't it? It'll help the cars move well. The health issues, there's no one looking at the health issues that a proposal like that would ever even get on the table. We know that walking and biking can be better when you look at the countries that have done better than the US has. So these are some data from the US compared to Germany and Netherlands. No surprise, a lot more walking and biking in the places that have had the better infrastructure, and also lower pedestrian fatality rates per 100 million trips, again, because they have invested in that infrastructure. In Portland, Oregon, which is one of the examples we often use just because it's a city that's had good leadership, that has tried to do a lot of things well, were able to show that as they invested over about a 15-year period, they quadrupled the number of miles of bikeways and did some bicycle counts and showed similar quadrupling of the number of daily trips on those bikeways. If you build it, they will come. They were also able in Portland to do some cost benefits. Now, often the cost benefits on health and built environment are difficult. We end up having to take a lot of estimates of what numbers fits what. But Thomas Gotchi did these numbers of the long-term bicycling investment in Portland, Oregon, and found some very favorable cost-benefit ratios of I think it was about a 30-year investment in biking, and could actually look at what some of the healthcare cost savings would be over that large investment over a long period of time, as well as fuel savings, and found very favorable benefit-cost ratios. One trend that we're starting to see in the US, and I'm hearing it may be happening in other places in the world, is for many years, going back to World War II, we had just perpetual increases in total vehicle miles traveled over time and vehicle miles traveled per capita. And it's just starting to slow down and starting to reverse. And so we're actually seeing that vehicle miles traveled per capita, how much each person drives, is starting to drop off in the US, and total miles, even as the population increases, is at least leveling out, if not starting to drop off. This has a number of implications. It's certainly wonderful from the environmental point of view and the health point of view that it means that other alternatives are being considered. Fuel consumption and fuel energy demand can start to level off, potentially go down. It also becomes, for the transportation world, a message of maybe we need more investment in some of those alternative forms of transportation. As long as the transportation world was looking at, well, vehicle miles traveled only goes up, well then of course we just need to build more roads. What else would you do? Is more people driving, more miles, we need more roads. But once we have a trend like this, it starts to give that message, let's look more seriously at what some of those alternative transportation forms are. Again, another one, behavior. How you build it, people will make their choices. This one's kind of fun because it's a fitness center and people are still making that choice. What it does say, though, is any place that has escalators and elevators or lifts, if you put the stairs so they are attractive and visible and in front of people, and you put the lifts and the escalators less visible, harder to get to, it does influence what people will choose to do. When they're both equally available, not real surprising what people choose. One area that we've done a little work in that can make a big difference in more walkable communities is safe routes to school, or children walking to school. The two biggest barriers for kids walking to school are the distance to the school and the traffic danger. Both of those are built environment issues. Distance depends on where a community chooses to put its schools, and traffic danger is something that any traffic engineer, given the political will to do it, can make safe for any pedestrian who's out there. We have schools like this. We want to build a school on cheap land its way out. We can virtually guarantee that no child will ever walk to this school. We can also take generally somewhat smaller schools, put them into higher density areas, and get it so that most kids will walk to those schools. And there's at least some data, not real firm, that habits gained by children as children, such as being physically active, will carry on for a lifetime. We took a look at safe routes to school, where there was some money for fixing the areas around schools, and when schools are reasonably close to each other, just literally draw circles around the schools. If the schools are relatively close to each other, you can end up fixing most of the community by fixing the areas just around those schools. So it's one of the sort of funding approaches to getting monies to fix neighborhoods, is if you can fix the areas around schools, you end up helping the larger community. In more rural areas, obviously, you don't help as much of the community. Let me mention some of the other ones from that original list of health and built environment. Air pollution, not good for you. I don't need to go at great length on that. This was a natural experiment trying to show, well, if you do clean up the air pollution, can we show that it will make a difference in health? And in Atlanta, which typically has horrible traffic, during the Olympics, the word was out that traffic jams will only be worse. There'll be total gridlock. Nothing will move. And people actually cut back on their driving during the 3 weeks of the Olympics and the 1996 Summer Olympics. During the 3 weeks, the peak traffic went down 23%, ozone levels went down 28%, and asthma-related emergency visits by kids went down 42%. So we had this temporary cleaning up, reducing traffic, cleaning up the air. Asthma got better. Olympics ended. Traffic went back up. Air pollution went back up. Asthma visits went back up. So this, good natural experiment, not perfect, suggestive that if you do clean up the air, we can make a difference in health. Water issues, particularly road runoff, parking lots, that we can contaminate our water supplies, a lot of really economic and environmental issues of how do you keep your water clean enough to use it. Motor vehicle injuries, major cause of death, 34,000 deaths per year in the United States, just an enormous number, millions in non-fatal injuries, billions in costs. It's the leading cause of death among young people. Mental health issues related to community design. Physical activity can both relieve depression and prevent depression. It's an incredible drug with minimal side effects that helping people be physically active can make a big difference in depression. Stress can be aggravated by long commutes, attention deficit hyperactivity disorder. Green space can help improve function in kids with that. Sometimes violent behavior, road rage, issues of just too much stress on the road. Social capital issues, how people interact with each other in communities, is affected by the design of those communities. Again, a picture from Portland, a place that looks attractive, a place you might want to be. You'd walk around, you talk to people, you do a little shopping, you have a cup of coffee. Social capital defined as social networking, civic engagement, trust and reciprocity. It's the interactions in the community. It is basically decreased by long commutes. People who spend a lot of their time commuting don't have that time to interact with their community. How do you build social capital? Make places people want to be. This was an example again from Portland where they just drew a giant sunflower in an intersection that didn't have a lot of traffic. And people came out to see it, and they'd stop and they'd talk to each other and they'd look at the pictures and really enjoy it. This should be a cartoon that we separate our elegant homes for really rich people one way and the middle-class homes another way and the adequate homes for the working class a third direction. I mean, you really don't want to see that in a society, and yet we do it. If you go out to probably most suburban developments, you'll find signs that exactly tell me how much you can afford and I'll tell you which housing development you can go to, and a major separation of people by their incomes. This was a fairly shocking graph when it came out relatively recently from Baltimore, and it was looking at life expectancy in a city. And two spots only 5 miles apart in the same city had a 20-year difference in life expectancy. And if you go to those two areas, the Roland Park with the good life expectancy has everything you would expect in a well-to-do, high-income area. It has good housing, has good food, has good transportation, has good education, has good jobs, has people who have everything they need to have a long and good access to healthcare, everything they need for a long and healthy lifestyle. And go barely 5 miles away within the same city. It's very dramatic. You'll find the low-income areas that do not have really any of the things that lead to a healthier life. Climate change issues, there's the term we use as co-benefits. If you design communities to promote health, you're also getting benefits across various parts of health as well as across mitigating climate change. So all the transportation alternatives, higher density, land use, parks, green space, energy efficient buildings, all these have health benefits as well as helping combat climate change. One of the approaches, we use the term smart growth. It goes under other names such as new urbanism and transoriented development, and there's a number of names all overlapping, each slightly different. What some of the features are: higher density, green spaces, mixed land uses, walkable neighborhoods, a good balance of transportation alternatives, heterogeneity architecturally, economically, racially, good balance of where investment is made between the city and the periphery. But the bottom line is it needs regional planning. If you allow every small community to do exactly what they want without any consideration of what's around there, you don't get any of the health benefits of what regional planning has to offer. This is like one of the hucksters at a carnival saying, you know, smart growth is good for all these things. Well, in fact, it actually has all these benefits, as we've been talking, that a well-designed, healthy community design can have all these benefits at various levels. Smart growth does have some political implications, and so how you frame it and how you word it makes a difference. It's about more transportation choices and less traffic. It's not saying don't have cars and don't have roads. They very much are a part of what we have and what we need. It's about having cities, towns, and suburbs. It's not saying get rid of all your suburbs. It's about having housing choices. It's not telling people where to live. And it's certainly not about opposing growth. It's trying to have planning toward your growth to improve quality of life. Just give you a quick example of what change can look like. If you take a look at that, it's a place that you don't really want to be. You would drive through it or pass through it because there's nothing there very attractive. And yet, if you add a bit of green space and add some transit options and add some housing and some shops, it becomes a place that becomes attractive and people want to be there. One of the approaches goes under the term complete streets, which is talking about that every street should be designed for all legitimate users. So rather than a road just be how many cars can I move, how fast, how well does it move pedestrians, how well does it move cyclists, does it accommodate transit if it's appropriate for that area. One other area we've done a little work in is looking at something called LEED for neighborhood development. Many of you may be aware of LEED for energy efficient buildings. It has actually changed the architecture world from where probably 20 years ago energy efficiency was really not a major consideration in designing buildings. LEED for buildings has gotten to where it's become more the norm that most new buildings will consider energy efficiency as part of them. Some will choose to be LEED certified to have that certification to display and ideally help the market to sell that building, but many or most buildings will at least consider energy efficiency in designing them. LEED for neighborhood development takes that one step further and says if we're developing an entire neighborhood, what are good principles and practices, not just for energy efficiency, but what's a walkable neighborhood, what makes it a place that people want to live, what's a health promoting neighborhood. So it's a set of criteria it's the U.S. Green Building Council that developed this. And what we are hoping over time is that LEED ND will have similar outcomes as LEED for buildings did, that as it sets out good principles, some communities may choose to get that certification, but we're hoping over time it would get to where most developers would say these are good ideas and would follow them whether or not they choose to be certified. Some of the health benefits of LEED ND, and these are basically your walkable communities that we've been talking about, reducing risk of obesity, asthma, motor vehicle injuries, increasing social capital, mental health, healthier diets by food availability. So it's the range of different impacts of community design on the community that LEED ND can help promote. I want to mention one tool that has turned out to be quite useful, and this is walkscore.com. How many of you have seen it? At least some of you. It does work here in New Zealand. It was developed in the States, but it works in Australia, New Zealand, and a few other countries. And it's www.walkscore.com. You can put in any address anywhere in the countries that it works in, including New Zealand, and it will give you a score from 1 to 100 of how walkable that particular address is. And it's been just having that tool lets developers, lets home buyers, lets people living in communities get a sense of what's walkable and how might we improve it to make it more walkable. It's essentially calculating the distance from that address to what some of the destinations in the area might be. It might be restaurants and bars and coffee shops and bookstores and grocery stores and so forth. One of its uses that has actually starting to get more and more useful is we can put a walk score value in real estate listings. And so we can get to where, and information does drive decisions. So if I want to buy a house and I want 3 bedrooms and 2 baths, and I want a walkability of at least a certain level, having that score in the real estate listings, and it's starting to show up in more and more US real estate listings, I'm not sure how much it's caught on elsewhere, can get to where home buyers then can consider the walkability as one of the factors in choosing where they want to live. this is one that I'm always kind of intrigued by, and the numbers will vary by where you are. But a lot of office buildings come with parking spaces. And if you start to look at the cost of that parking space compared to the investment of what was done for that employee, and a lot of buildings are starting to have smaller offices and cubicles. And the numbers, as I say, will vary. Generally, the amount of space for the car is larger than the amount of space for many employees. I mean, obviously not the top of the chain, but many of the staff will have fewer square feet for their workspace than is allotted for their car. And the cost for that parking space, in some cases, can be as much or even more than was invested in that employee. And it's, that says something about, where do we put our priorities? Now, I'm a cyclist. I would just as soon look at this and say, okay, if I'm not driving a car, does that mean I get twice the office space? That might be a hard sell, but hey, it might be worth a try. I'd like to spend a few minutes on health impact assessment. This is one of the tools that we've been using. It goes back to us in public health looking at, we'd like to talk to the planning world, the building world, the people who make those decisions, and yet we don't really have a common language. We don't really have a forum or a means to convey that information of what the health impacts may be from something a planner or other decision maker is making. Health impacts assessment started in Europe, have spread around the world. We're now using them more in the US. You do use them here in New Zealand in some places, as well as in Australia. It's the formal definition is a systematic process looking at various data, has input from stakeholders to look at the potential effects of a project or policy or program on the health of a population with the intent of coming out with recommendations of how could we improve that proposal before it gets built or goes into effect from the health point of view. The vision would be that planners and others making decisions really are looking out for the good of society, and they would like to have that health impact to be part of that decision. And this gives health officials then a tool with which to convey that information for those decisions and ideally end up with a better decision. At no point is health saying we want to control all these decisions into other sectors. That is not the intent. It does not make sense. What matters from the public health point of view is that health be at the table, that health be considered in these decisions, and that the health considerations should be balanced against all the other elements that go into decision. Obviously, finances and feasibility and politics and all the other things that go into decisions, it makes sense that health be one of the factors being considered in decisions. Very briefly, how health impact assessments are done: screening to decide which projects and policies do they make sense for, scoping what issues should be included, assessment who's affected and how, recommendations of how could this proposal be improved to promote health or to mitigate any damages that it might be causing, reporting, getting that information back to the decision makers, and then monitor any evaluation. One big issue is, should a health impact assessment be voluntary or regulatory? Most of the ones in the US, as well as in much of the world, have been voluntary. It's more politically acceptable, it's simpler, it's less expensive, it conveys information. However, it doesn't get used as much as it could if it's voluntary. As soon as you make it regulatory, it does get used more, but a lot more political pushback. It can be very litigious, much more complex, much more expensive. Another issue is what is qualitative and what is quantitative. And this is really a big issue, because ideally we would have numbers for everything, be able to do cost-benefit ratios for anything we might be suggesting. But in reality, a lot of those numbers don't exist and are very hard to get. So, simple example, I want to build a sidewalk. Well, I have plenty of evidence if I build a place for people to walk, people will use it, people will walk more. But as soon as you say, how many more people will walk? Okay, I'm going to build a sidewalk and 300 people will live within 200 yards, will walk an extra 15 minutes a day, and they're going to lose 17 pounds over 4 years, and will prevent 3 heart attacks with a cost savings of X. That kind of modeling doesn't really exist and is incredibly, I'm not sure I would believe it if you gave me a model like that, because there's so much variability in how much people walk on a particular path that to try to get down to that level. Well, for a cost-benefit model, I'm kind of stuck. I can say it's in the right direction, I can say it's the right thing to do, but I have a lot of trouble doing a cost-benefit model because I can't get models that will get down to that level of how much impact a choice will make. For some things, we do have some numbers. So the U.S. Department of Transportation did a large travel survey, several 100,000 people, which had a subset of about 3,000 transit users. And we looked at how much walking there was to get to and from transit, buses and trains. And most bus and train trips begin and/or end with a walk, because you really can't drive at both ends very easily. And we were able to find that there's a median of 19 minutes a day of walking, just getting to bus and trains. And so here's one where if you put in a transit system, we're able to give you some data saying that the median for the country is here's how much walking, here is the physical activity benefit, here is the health benefit of putting in a transit system. HIAs typically involve the community. They help with community buy-in. They may bring up other issues. It is routinely used with environmental impact statements and commonly used in HIAs in Europe. It does take some time and resources, so not all HIAs have community involvement. We have some evidence of the impacts of HIA on subsequent decisions. Some specific places where a plan was improved for pedestrian safety or redevelopment helped provide some housing for people being displaced and so forth. Most HIAs at least improve and raise health awareness among the planners and decision makers. So when we've done evaluation studies trying to document here's how much difference that HIA made, it can be relatively difficult to show the cause and effect. This HIA caused that decision to make a certain change in it. But the raised awareness part is really common for most HIAs. The U.S. has had several hundred HIAs pretty well scattered around the country, leadership particularly on the West Coast and California in particular. Range of topics for which HIAs have been used, housing, pedestrian trails, transportation plans, after-school programs, living wage ordinances, sick leave policy, power plants, oil and gas leasing policies in Alaska, quite a range of different policies and programs and projects for which HIAs have been used. An example of a relatively recent one, there was a large football stadium being proposed in Los Angeles. It would displace a large number of low-income people, a lot of politics around it. The people with the money, of course, want their football stadium. They're going to make money building it and do quite well on development. By doing a health impact assessment of the adverse health consequences of the low-income people being displaced, health and the advocacy groups were essentially able to get a seat at the table and work on negotiating some mitigations. And so they were able to, with the advocacy groups and with the information from that health impact assessment, get some money for some affordable housing for the people being displaced, get some more parks and open space and other neighborhood improvements. So by having that health information there and working with advocacy groups, you're able to actually point to here's a place where it made a difference. That information did help with negotiations and got better outcome for people in that area. I want to spend a few minutes on health and sustainability and the co-benefits related to them. Health and sustainability overlap a lot. The definitions are similar, again, overlapping. The WHO definition I gave you, complete physical, mental, social well-being, not merely absence of disease or infirmity. There's another definition, is what we as a society do collectively to assure conditions in which people can be healthy. The sustainability definitions have to do more with resources. How do we use a resource so that we don't deplete it or permanently damage it? How do we do development that meets the needs of the present without compromising the ability of future generations to meet their own needs? There's a lot of overlap between green, sustainable, and healthy actions in the center. If I build and use walking and biking infrastructure, it's sustainable, it's a green, environmentally friendly choice, and there are obviously health benefits of having that walking and biking infrastructure and other examples. There are some things, while everything is compatible, there are some things that are more green but don't have a big health impact. So for example, if I recycle newspapers, that's good for the environment. Not going to have except minimally much impact on the public's health. If I go out and get regular exercise, that's clearly good for my health, doesn't have a lot of impact on sustainability. But there's quite a few things where there is overlap between health and sustainability. To run through some of the areas on climate change benefits along with that, buildings in particular, and this has to do with using non-toxic materials, a lower carbon footprint, energy efficiency in the design of the buildings are some of the green and sustainable benefits. These are fairly obvious in that direction, and the health benefits of improved air quality, of physical activity, if you have good stairs in the building, of natural lighting, of decreased toxic exposure. So that's on the building side. Transportation side, I think we've mentioned most of these, but increasing active transit has obvious climate benefits along the way with air pollution and CO2 emissions and resource use, and the health benefits of physical activity and decreased air pollution and injury issues. That's all as mentioned. Overall urban design really overlapping a lot of what you just saw for transportation in terms of the climate benefits, resource uses, increasing physical activity, increasing social capital. Transportation and land use and urban design all substantially overlap. Conserving nature, again, benefits both the sustainability green viewpoint as well as health, the climate benefits of carbon sequestration, habitat resiliency, biodiversity, along with giving people places to be physically active, some protection from disasters, as if you put high-risk areas, protect them from people building in them. Energy uses, again, all these are overlapping terms in terms of co-benefits that using more renewables, decreasing CO2 emissions, and health benefits along with that. Food and agriculture, as we do more local production, organic farming, get more climate-tolerant crops, eating lower on the food chain. Has climate benefits, reduced deforestation, less fuel use in transportation, soil conservation, other climate and environmental benefits, along with health benefits of healthier people, less heart disease and cancer and pesticide exposure. Preparedness as well has sustainability and climate benefits as well as health benefits. As we work on resiliency and sustainable infrastructure, and have coordinated response, we can increase the climate benefits, increase public awareness, more efficient recovery after there are disasters, as well as decreased morbidity and mortality in the disasters, increased social capital as people are prepared and ready to work together. This is a list of many of the approaches to promoting healthy community design. And I'll be wrapping up in just a second. And so I want to throw out a lot of these we've already mentioned, some of them not, and we can come back to any of them in the discussion that you want to bring up. But there are quite a few different ways to approach how do you design a healthy community. Some are what you build, some are the policies that you set, and we can learn from each other what has worked in different communities, which ones work. So just running through this, and I've mentioned some, but not all of them. We mentioned complete streets, transport funding, deciding where do you put your money, urban growth boundaries, where do you allow things to be built. Joint use policies is the concept of having school grounds be used by the community when the school is not in session as a way to increase green space and access for places for physical activity for the broader community. School siting, putting schools in places where kids can walk more. Rail to trail conversion. We have a lot in the States where abandoned rail lines become trails and are very well used in the States and can be done elsewhere. I mentioned that to someone from Europe, and they kind of looked at me and said, we don't abandon our rails, we use them. So over there, it was not as useful there. Unbundling parking is a fascinating one. Why should every house and apartment come with its own parking space? If you separate the cost of that lodging from that parking space, then the person who is buying that apartment or condo or whatever it is can make a separate economic decision whether they want to pay for that parking space. And it actually works both in favor of those who want more active transportation and sort of help people think about, do I really need to have that car or that second car once that cost of parking is separated from that purchase or rental decision. Bike share programs starting to catch on. I saw you have one in Auckland. They're starting to catch on around the world in a number of cities. A way to get people physically active, give people some more transportation alternatives. LEAD and D we mentioned. Walk bike friendly cities. Another certification process that if you fill out a form from there, this is a US one, but it may be elsewhere, of how walk friendly or bike friendly is your city. And do you have bike racks, do you have bike lanes, do you all the various features, and so you get a certificate, and it becomes something that you can brag about for your city. And some of these certifications then start to attract industry and start to attract jobs, because people look at it and say, oh, it's a bike-friendly, walk-friendly city. This is a place I might want to live or my employees might want to live. Second column, active design guidelines, a set of guidelines for healthier buildings. It's on the website under New York City. Walk score we mentioned, health impact assessment we've mentioned. Multimodal level of service, fascinating concept in the transportation world, that most work is done under level of service, focuses on how well do cars move more cars faster, that's a good level of service. If they're congested and slow, that's bad level of service. If you do multimodal level of service, you don't just look at the cars. How well do people move? How well do the pedestrians and the bicyclists and the motor vehicles and transit, how well are they all working? And so it's getting that balance there. And if a transportation department is willing to consider that as their standard, to look at all modes, you'll end up with a much more healthy transportation system. Safe routes to school, we've mentioned, but safe routes to other places. Can you walk to your nearest park, or is it a dangerous crossing? Can you walk to your nearest transit stop, and so forth? But once you start looking at safe routes, you can look between where people are and the destinations they may want to go to. Health element in comprehensive plans. We do what's called general plans or comprehensive plans in most cities that look at a city or a region over the 10, 20, 30-year longer term. And we're starting to have more of those comprehensive plans that will put health as one of the considerations in what is being planned. So these are being done by planners, but they're starting to engage with the health professionals as to how do you get health into some of those plans. And just a couple other brief ones. Retrofitting failed suburban shopping malls. We end up in some suburban areas when a shopping mall gets to 20, 30, 40 years old, it starts to fail. It no longer meets the needs, no longer is attracting people. That turns out to be land with pretty good infrastructure that in some cases can be retrofitted and become a very good mixed-use community on redevelopment. Health on all policies is a whole other area some of you may have heard of, which is trying to, rather than just use HIA, but getting other sectors across government and across society to consider health in anything that's being decided. So that's education, that's transportation, that's agriculture, that there is a health element. And so being able to work across sectors on a government level generally. And then finally, just want to mention training our workforce so that people in public health know something about planning and people in planning know something about public health. And we now have some courses and some joint degrees where people will get training in both public health and planning. And ideally we'll start having those jobs in the planning world and in the public health world, where by knowing about both fields, they'll speak both languages and be able to convey those messages across those fields. We have a book out, Making Healthy Places, with Howie Frumpkin and Dick Jackson that covers a lot of these issues. And let me end with that. I'll mention two websites. The cdc.gov website, Healthy Places, covers all these information from Centers for Disease Control. And then the Health Impact Project has a lot more information on health impact assessment, if you're interested in that. So with that, let me stop, and I would welcome discussion for whatever amount of time we have.
Thank you very much, and thank you for leaving time for questions. There are some seats down front. So can people, I think it's helpful for Andy knowing what background you come from. You just briefly say what your background is.
Okay, go ahead.
My name is Mark. I'm a master's student in environmental studies
Okay.
at the university.
Good.
I was just wondering, do you believe that there's a trend between increasing livability and increasing housing prices? And how do you combat against that?
Okay, very good question. Housing prices and livability. Term we often use is gentrification. Are you used to that word or not. This is an ongoing issue, that as you take a low-income area, you make it more livable, walkable, and attractive, prices do go up. And you certainly can end up displacing people who cannot afford places they were living. And so it's not something we have an easy answer to. There are a number of approaches that go with it. Part of it is seeing that there is and will be and should be affordable housing. And so some of it has had to do with incentives and disincentives for developers, that if they want their building permit, if they want to be able to put a certain density in, if they want to do certain things in what they want to build, it is possible to put the incentives and disincentives to see that affordable housing will be part of what they build. And so we have a number of examples where that was done. In some cases, they call it a density bonus. The builder can make more money by the amount of density that you can squeeze into a particular spot, and if the builder's willing to put some affordable houses within what's being built, they'll be allowed to build more units in a particular area. There's a number of approaches. I'd have to say we don't have the perfect answer, but it's certainly worthy of more attention of what the best solutions are. But we do need affordable housing. And as we do make places more livable, the changes in prices really are a concern. Okay. Hi. Okay. Yeah.
I just wondered if you could say, this all seems brilliant and sort of obvious.
Yes. Yes.
So what's stopping us? Why is it ideology? Is it nurture? Is it the oil industry? Is it the car industry? Is it developers? I mean, why is it so difficult?
Yeah, okay, I can repeat that.
It's just,
Yeah, okay. The comment is, this seems obvious, which I totally agree with, and why aren't we doing more of more livable communities? The barriers you just mentioned, it's sort of all of the above. There is politics, there is finances, there is political will, there are developers who want to do what they're used to doing. I think it's gradually going that direction. Some of the barriers include financing. Banks are used to doing what they're used to doing. And so we've heard stories, for example, a mixed-use community that has the stores on the first level and has residences above is a mixture of commercial and residential. And there are banks that have a commercial department and a residential department. What do you mean you want to borrow money to put them in the same building? We don't do that. I mean, that seems not so hard to fix, but if that's how their bank is set up, they're literally not able to figure out how to solve a problem like that. Developers are used to doing what they've done. They will say, look at the market demand. Here is what we sold last year, and the people were coming out to buy it. So over time, I think that market demand will shift. And I think younger people are starting, I mean, one of the exciting things we're seeing is younger people are starting to get their driver's licenses at later ages and lower levels because they're starting to build that demand that where they want to live may be a more walkable area. So I think it's slowly getting there. The politics of it, I mean, there's clearly a large road building, automobile producing segment of society. They're not real excited about more bicycle lanes. And there are also people representing areas where it's not practical. So the more rural legislators will say that doesn't work in my area. Why should I vote for any resources that will improve bike lanes or public transit in the city? So I mean, there's politics, money, all of the above. Everything you mentioned is certainly part of it. I guess we're seeing enough trends in the directions. Urbanization is generally increasing across the world. And I think a lot of these principles are people becoming more aware of it, and the demand is going that direction.
Ben?
Are you saying that there should be more incentives to assist the progress of these ideas?
My feeling is that we need to work with the market. And what that means...
Gets behind, doesn't it?
What?
The market drags, doesn't it?
You can go... either be ahead or behind it. You can pass policies that create those incentives. So for example, a policy in Maryland, they passed, essentially looked at where they wanted to see growth and where they would not. And the areas they wanted to see growth, the government said we will make sure it gets the infrastructure it needs. It will have the roads, it will have the sewers, it will have the electricity and telephone and so forth. In the areas we don't want to see growth, we're going to make it very difficult for you to get some of that facilities out there. Well, the developers looked at that and they follow those incentives. The incentives were it's going to be a whole lot easier to build in the areas. There was no one saying don't build in the areas where the government was trying to discourage it. So it was setting policies that do offer incentives and disincentives. And the developers, tended to follow them.
Craig Barber, I'm a submitter against the excuse me, the proposed flyover in the centre of the city. One aspect that interests me is when you raise freeways and have flyovers, etc., does that increase the dispersal of vehicle emissions and therefore increase the territory of possible respiratory disorders? And the other question is allied to that. If you put up noise barriers on the side of the motorway, does that to some extent also confine the vehicle emissions?
Good questions about air pollution with the flyover and noise barriers, and I don't have any specific information on that. I would say for the flyover, which Philippa has mentioned, that something like that would be very appropriate for a health impact assessment, to have people look at it, model it, and say, well, what does it do to health? What does it do to factors other than just moving traffic? And let that information help with that choice. But I don't have specific information on your questions.
Russell, would you like to follow
Okay.
on that question? You mentioned who you are.
Yeah.
Just to mention-
I'm from a health and climate
Okay.
focus group,
Yes.
and we have made submissions on the flyover. And my question of you is, how do you convince the planners that a health impact assessment should be necessary?
When to use health impact assessment and how do you get it accepted by the people who are making the decision? Very good question for which we don't have the perfect answer. The short version is that the more partnerships and links that get built between the health world and the planning world, either around a particular project or over the longer term, multiple projects, then that information gets more consideration. In any one case, there's politics in many or most decisions. It's not a real surprise. But those personal connections really can make a big difference. One of the health impact assessments we worked on in Atlanta, I was working with Catherine Ross, who's a professor of planning at Georgia Tech. She previously had been a regional transportation authority. So she had been part of the system, knew everybody in the system, and so the recommendations that came out of that, she could directly talk to the mayor and all the other decision makers because she had been very much a part of the system. So building those interactions can make a difference. If you have a receptive audience, they will listen. If they want nothing to do with you, we have HIAs that have been totally ignored because there was no receptivity. So it becomes partly politics, but building those partnerships ideally in advance can help it.
And Patrick's from the site.
Yeah. Hi.
I'm the vice of that.
Good.
Thanks for making the long trip. Put up a chart about the drop in vehicle miles travelled in the US. Some people say that's linked to the recession.
Yeah.
But in your chart it appears to precede
Yes.
the recession.
What I've been hearing is whether the changes relate to the recession. What I've been hearing is it's not entirely the recession, that there's enough data there, and I don't know if it was separating places that weren't as hard hit by the recession or what the actual dates were, but the recession is a component of that, but it seemed to be going in the direction that it's real and not entirely due to the recession. I mean, a few more years of data will tell us that it's suddenly jump back up, but from what I'm hearing, it's recession plus other issues that are heading that direction.
This theory is sort of long-term demographic change
Yes.
and preferences.
Yes. Well,
Transport.
yes.
So we've got time for 2 more quick questions.
Okay.
Okay.
Mike Bay from the Times here. Thanks, Andy, for a great talk. I particularly like the menu of approaches that you listed up there and going through those. That was very useful. I just had a question for you about how we frame some of these fundamental terms like growth, because growth is usually equated with population growth, and it seems so endemic in planning, the idea that countries will grow, cities will grow, regions will grow, and in fact, local authority representatives will always be pro-growth,
Right.
seen as positive. But I'm wondering if you've had any success in actually reframing that, because that's obviously not sustainable. We've had an example in New Zealand recently where Wellington was described perhaps as a dying city because it's not growing at the breakneck pace of Auckland. But actually, how can we embrace the idea of even stasis?
Cities go at different levels, and we do have cities like Detroit and others that are actually shrinking, others that are stable, and others that are growing. I think the message for community design is that whatever direction it's going, to have the choices consider health in what is being done. Generally, growth is generally seen as positive for a healthy community, but you can have a healthy community that is not necessarily growing. You can improve the livability in a place that is not changing that much.
I'm Jorijntje Makkerbach from the Netherlands, and I would like to comment on the question before about why are we not just changing the urban environment, because it's so obvious. And I would like to give an example from the Netherlands, where we have lots of bike lanes, lots of walking paths. We have a very dense areas in the Netherlands, everywhere it's very dense. And still we have high air pollution, high obesity rates, a lot of problems. So I was wondering, to what extent do you think that different contexts in which the cities are built are comparable between countries? Obviously, a country like the USA is very different from the Netherlands. So where density or sprawl is a problem in the USA, it might not be as much a problem in Europe or maybe New Zealand. Mm-hmm. What do you think about the comparability between countries and the policy implications for that?
How to compare countries, and obviously every country is different, and there are certainly different factors in there. I look at it as compare them with caution. And so, if we look at Netherlands and see a very high rate of biking and walking, and look at US at a very low rate, it's not saying we are ever going to catch up in the US to match the Netherlands rate. There are too many differences between those countries. But it does say it can be better than it is. And so that I think comparing across countries gives an idea of what can happen, and then those differences will account for the fact you're never going to quite match what another country did.